Hello, and welcome to Aging Well with Dr. Bob. I'm Dr. Bob Flaherty. I'm a family physician, and today I'll be discussing sleep and aging. I'll talk about how our sleep changes as we age, and I'll give you some tips on better sleeping. The information in this presentation is supported by high-quality medical research and expert medical opinion, and references are given at the bottom of many screens. This presentation is for information only. Before you act on anything you learn here, be sure to discuss it with your doctor, physician assistant, or nurse practitioner. Shakespeare knew what we wanted when we sleep. He said, "Sleep that knits up the raveled sleeve of care, the death of each day's life, sore labor's bath, balm of hurt minds, great nature's second course, chief nourisher in life's feast." But Shakespeare also knew that we don't sleep well sometimes. He said, sleep, O gentle sleep, nature's soft nurse, how have I frighted thee that thou no more wilt weigh my eyelids down and steep my senses in forgetfulness?" And in fact, at least 25% of seniors complain of poor sleep. We know that poor sleep puts you at risk for obesity, depression, type 2 diabetes, cardiovascular diseases like high blood pressure, heart attacks and strokes, accidents, and difficulty with memory and making decisions. This is a sleep cycle. It occurs every 90 to 120 minutes as we sleep through the night. It begins with us falling asleep and entering stage 1 of sleep, light sleep, and we can be easily awakened. We then move to stage 2, where eye movement and brain waves slow down, then into stage 3, where delta waves begin to appear, and delta waves are the hallmark of deep sleep. Stage 4 is deep sleep, where we're difficult to awaken. Importantly, at this point, brain cleaning begins in this stage. Then we move into REM stage, where breathing becomes more rapid and irregular, but this is a stage where memory consolidation to make our memories easier to retrieve, and also dreaming occurs. Then we move back into stage 1 and continue through the stages through the night. Let's look at these sleep cycles through a typical night. We fall asleep and we drift down into stage 1, stage 2, stage 3, and that brain cleaning stage 4 of non-REM sleep. Then we drift up again into stage 1 and REM sleep, where memory consolidation occurs, and then down again, stages 4 and back up to REM sleep. Notice a couple of things. REM stage prolongs as we go through the night, but also we don't go into stage 4 brain cleaning after about the middle of the night. Here's a little aside. Before the Industrial Revolution, people slept in 2 different periods. They slept from 9 until 11 p.m. Then they were awake from 11 p.m. to 1:30 a.m. Then they would sleep from 1:30 a.m. until dawn. And this suggests that, in fact, sleep is a habit, since their sleep pattern is quite different from our current sleep pattern. Also, the sleep cycle pattern through the night of young adults is quite different from elderly, and that explains why us seniors have more trouble sleeping. In young adults, they fall asleep quickly, get down into the stage 4 sleep, up into REM, quickly down into stage 4 again, longer REM period, may awaken a little, down into stage 3, up into a longer REM period, perhaps awakening a bit, but easily falling back asleep, longer REM, and then they finally go into REM and they awaken. For the elderly, it takes a little more time to fall asleep. and we get down into stage 3, perhaps not even into stage 4 to clean the brain. But we awaken, fall back asleep, a little bit of REM, and awaken, and variable periods of REM sleep through the rest of the night. So as a result, compared with young adults, we tend to have delayed sleep onset, fragmented sleep with increased awakenings, and decreased time in sleep stages 3 and 4 where brain cleaning and REM memory consolidation occurs, such that by the time we're age 90, those REM and stage 3 and 4 periods are gone. And as a result, we have a decreased total sleep. Also, if we see that this changes as we age, total sleep per day and percent REM sleep decreases from infancy up to age 80. So that by age 80, we have about half the total sleep per day and about half the REM sleep. So the bottom line for seniors is that we have problems falling asleep, we wake up too early, we have trouble falling asleep again, and as a result, we have a lack of rest after sleeping. What causes these changes? The suprachiasmatic nucleus in the brain here is our internal clock. It's sensitive to daylight, even though it's deep in the brain. It controls our 24-hour daily cycles like hunger and hormone release and sleep. But what happens is this SCN deteriorates with age, so that our sleep clock becomes less effective. A number of things aggravate our sleep. Medications certainly, like blood pressure medications, antidepressants and stimulants, prostate medications, our old arthritis friend glucosamine and chondroitin, and perhaps statins. Recreational drugs also aggravate our sleep, like alcohol, caffeine, and smoking. Emotions can aggravate our sleep, like depression, and all of us know that if we're feeling anxious and stressed and have worries, we'll have trouble falling asleep and staying asleep. The sleep environment is very important. A room with too much light, especially blue light, before bedtime can aggravate sleep. Too much noise or a room that's too warm or too cold can aggravate our sleep. I mentioned that sleep, it has a lot of habit associated with it, and poor sleep habits will aggravate our sleep, like exercising too close to bedtime, caffeine late in the day, working right up to bedtime, irregular bedtime and awakening times, and eating heavily before bed. Medical problems can certainly aggravate our sleep. Heart failure, having to go to the bathroom at night, acid reflux, chronic pain like arthritis, and obstructive sleep apnea, which occurs in about 10% of adults, can aggravate our sleep. Let's take a minute and talk about obstructive sleep apnea. People with obstructive sleep apnea cannot maintain an open airway when they sleep. Normally, without sleep apnea, the airway remains open. But people with obstructive sleep apnea, when they go to sleep, the muscles relax and close off the airway. And as a result, they'll have snoring, choking, or gasping while asleep. They'll stop breathing while they're asleep. They'll have morning headaches and daytime tiredness. What about sleeping pills? I'm commonly asked about this. Well, let me give you a little background. The American Geriatrics Society provides the Beers criteria. This was developed by Dr. Beers of potentially inappropriate medications for older adults. These are medicines that are typically best avoided by older adults in most circumstances, older adults being people over 65. With sleeping pills like Ativan, Dalmine, and some of the Z drugs, There's increased risk of cognitive problems, confusion and delirium, falls, fractures, dementia, more ER visits and hospitalizations, and more motor vehicle crashes. There's also sleepwalking and sleep eating, next day drowsiness and grogginess, and impaired driving for up to 24 hours. And even with melatonin, you can get daytime drowsiness and drug interactions. What about that glass of wine before bed or other alcohol? Well, that certainly can cause you to fall asleep quicker and get into the stage 3 and 4 non-REM sleeps, but you don't get back up into REM sleep. You get into a shallower stage, and you might miss out on early REM sleep. But also, later in the evening, sleeping, you will rebound beyond REM sleep. And as a result, you may fall asleep sooner, but you'll decrease the depth and duration of later sleep cycles, and these are times when brain cleaning occurs. It'll suppress and then may bypass REM sleep, which is the memory consolidation time, and move into lighter sleep. Well, I said pills are not good, and alcohol is not good for helping sleep. What can help, though? Cognitive behavioral therapy for insomnia has been shown to be an effective sleep improving measure. In fact, it's been called the first-line treatment for insomnia. It's designed to deepen sleep, to regularize sleep patterns, and to elicit a physiologic relaxation response. You can get CBTI through in-person counseling or even online. I'd like to give you some sleep tips that'll help you to fall asleep and stay asleep. First, don't exercise within 2 hours of bed, but do exercise sometime during the day because that definitely improves sleep. Don't eat within 2 hours of bedtime and avoid caffeine after supper. In fact, it might even be better to avoid caffeine after about 3 p.m. Establish a pre-bedtime routine. Turn off bright screens and any sources of blue light like TVs, computers, and smartphones. Do calming activities like a bath or shower, reading or prayer or meditation. And for bedtime reading, red light is better. And in fact, I've put a red light in my bedside light, and I think it makes a big difference in helping me to fall asleep quicker. Go to bed and wake up within an hour of the same times each day. Aim for 7 to 8 hours of sleep per night. Make your bedroom dark and quiet. And use the bedroom only for sleep and sex, not TV. Sleep cool. And also wear socks. This sounds crazy, but I've had patients and friends do this, and they say it's the best thing they've done to improve their sleep. Give it a try. Wear eye mask or earplugs if necessary. And if your blanket cramps your toes, consider a blanket lifter. This is a device that fits under the mattress and holds the blanket up over your toes. That can be a real benefit if the blanket interferes with your sleep. If your worries keep you awake or keep you from falling back to sleep, keep a notepad on your bed. Write down your worry and your plan for tomorrow, and you'll find that you'll easily go back to sleep again. If you awaken and can't fall back to sleep, get out of bed. Don't thrash around in bed, but get up and read or meditate or pray for 20 to 30 minutes, not longer. Then return to bed, but no TV, cell phone, or computer, because that is blue light that'll keep you awake. If you find you sleep with your mouth open and that aggravates your sleep, try a saline nasal spray or nasal strips that can open up the nostrils. And if you snore, get checked for sleep apnea. What about naps? Naps have a lot of positive effects. They're relaxing, they reduce fatigue, They increase alertness. They improve mood. They improve performance, including quicker reaction time and better memory, and perhaps decrease the risk of cognitive decline and dementia. And also naps feel so darn good. There's been concern about negative effects. And yes, grogginess and disorientation can occur after a nap, but that generally goes away quite rapidly. It appears that naps do not cause nighttime sleep difficulties, although longer or multiple naps a day might. We don't know of any other potential problems. So all in all, naps are good things. And a good nap is 30 minutes or less before 3 p.m. in a quiet, dark room with a comfortable temperature and no distractions, just like you would do for sleeping at night. Well, I hope you found this helpful, and I wish you a good night. Thank you for watching this presentation. I hope you found it informative and helpful. If you did, please click like below and subscribe to keep up to date with new presentations. Best wishes and age well.